What are stroke clot-busting drugs, tPA? Imagine a stroke happening when a blood clot suddenly blocks blood flow to part of the brain. This can cause serious damage because the brain cells don't get the oxygen and nutrients they need. In emergency care, doctors sometimes use a special medication called tissue plasminogen activator, or tPA, to help. tPA is a natural enzyme that the body produces to help dissolve blood clots. When given as a drug, it works by attaching to a protein called fibrin, which is part of the clot. This activates another substance called plasminogen, turning it into plasmin. Plasmin then breaks down fibrin, effectively dissolving the clot and restoring blood flow. This process helps limit brain damage caused by the lack of oxygen. Timing is everything with tPA. It works best if given within a few hours after stroke symptoms start, usually within 3 to 4.5 hours. The sooner it is administered, the better the chance of saving brain tissue and improving recovery. However, because tPA promotes clot breakdown, it also increases the risk of bleeding, especially in the brain. That's why doctors carefully evaluate each patient before giving it to make sure the benefits outweigh the risks. tPA is usually given through an intravenous line, meaning it is injected into a vein. It is the standard treatment for eligible patients with ischemic strokes, which are caused by blood clots. It is important to note that tPA is not used for hemorrhagic strokes, which happen when a blood vessel in the brain bursts and bleeding occurs. Using tPA in that case could make bleeding worse. In summary, tPA is a powerful clot-busting drug that can save brain tissue if given quickly and carefully. It works by dissolving the clot that blocks blood flow, helping to restore oxygen to the brain. But because it carries risks, it must be used only under strict medical supervision and after thorough evaluation. Always remember, if you suspect someone is having a stroke, immediate medical attention is crucial to determine if tPA or other treatments are appropriate. It is a vital part of emergency stroke care supported by health authorities worldwide, but it is not a one-size-fits-all solution.